Now to a warning to those headed overseas. The Centers for Disease Control and Prevention has updated its travel advisory for polio. It now includes 30 locations where the virus was found in the past 13 months. The most recent update adds Laos, Namibia to the list and removes Finland, Ghana, Spain, and Zimbabwe. The remaining destinations span Europe, Africa, Asia, and the Middle East. The confirmed discoveries include samples taken from both human patients and wastewater samples. Now, polio cases began slowing significantly in the U.S. in the late 1970s following widespread vaccination campaigns. In 1994, the World Health Organization officially declared the disease eradicated in the country. And Dr. William Schaffner joins us now. He's a professor of medicine at Vanderbilt University Medical Center. Dr. Schaffner, thank you so much for coming on and explaining this to us. Why is the CDC updating its advisory now? What's the timing like here?
Well, the timing is exactly as you say, Tom, and that's because we do surveillance. That is, we look for the polio virus around the world constantly in collaboration with the World Health Organization. And over the last 12, 13 months, they've seen an increase in the number of detections of the virus around the world in many countries. The core countries continue to be Afghanistan, Pakistan, and Nigeria, but viral variants have been found in other countries, including European countries such as Germany and also the UK. So the CDC's advisory is, think about that if you're traveling to any of those countries. And although we've all been vaccinated against polio when we were very little, you might consider getting a booster dose of the vaccine before you go.
Yeah, you know, doctor, I have traveled extensively internationally and actually had to get one of those boosters at one point. A lot of people out there probably wondering when and how often people should get vaccinated for polio and how effective the vaccine is. So explain that to us.
Well, the vaccine is wonderfully effective. You know, back when we were young, we took that vaccine orally on a little sugar cube. But the vaccine we use now is an injectable vaccine for safety reasons. And the vaccine is excellent. But over time, over many years, your protection can wane. And so the CDC is saying, if you're going to any of these countries, think about getting a booster. You only need one booster in your adult life, and then you're good.
Yeah, you know, that's a really good point there. Dr. William Schaffner giving us some medical advice on this Friday. We appreciate it, sir, on such an important issue. Thank you for coming on.
My pleasure.